Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Dr. Philip Fisher is a pediatrician at Mayo Clinic. And not long ago, he was leading some medical students on rounds, and they checked in on a patient who was waiting for a kidney transplant. You know the rest of the story.
I do, and I'm excited to share it. Afterwards, some of the medical students started joking with Dr. Fisher about donating one of their own kidneys to get a better grade on that rotation. And that got Dr. Fisher thinking about his own place in this world and what he had to give. Here to share his story is Mayo Clinic pediatrician Dr. Philip Fisher. Welcome to the program, Dr. Fisher. It's nice to meet you.
Thanks. It's nice to see both of you.
Great to have you on the program. So take us back to that day, and was it 2011 when this actually happened?
About 5 years ago, 5.5 years ago, normal rounds, normal everything, and I started to joke with the students, and I realized this isn't funny. We're talking about a serious thing. This child needs a kidney. We've each got an extra. Maybe we should get involved and do something and not just joke about it.
And none of them volunteered?
None of them did. None of them did. And I decided I shouldn't put pressure on them.
But you thought it was a good idea for you.
Yeah, somehow it stuck in my mind. I don't know what it was about that teachable or open moment. It just stuck on my mind for a while. I talked to my wife about it, talked to a couple of friends who were doctors dealing with kidney disease. And my question for them was, is this crazy? Should I even think about such a thing? And it went from there.
What did your wife say?
Yeah.
She already knew I was crazy, so that was all right.
What about your colleagues? Did they know you were crazy?
Yeah. Actually, on the crazy side of thing, if we fast forward, I had to go through all of this screening to make sure I was healthy enough. And part of that includes a psychiatry consult to make sure that I'm doing this for appropriate reasons. And the surgeon said, don't worry about the psychiatry thing. It's just a rubber stamp to make sure everything's okay. I finished the psychiatry discussion, and the psychiatrist said, okay, I think we need more information. I'll have to talk to your wife. Anyway, so my wife got her words in anyway.
Did you know at the time who the recipient was going to be?
No. The child that stimulated all this that needed a kidney had a different blood type than me. He ended up getting a kidney in a couple months after that before I was ready to donate. So I went through the anonymous donor program. So I didn't know anything about my recipient. I think I heard that it was a female and knew it was a woman beforehand. I got to know her 3 months later when she sent me a thank you note, but she opted to keep it confidential and not sign it. So I learned a little bit about her in the thank you note, but I still don't know who it really was.
I think when someone knows someone who needs a kidney, it's easier to say, yes, I will donate that kidney to you, or I will be part of a chain so that you can be a recipient of someone else's kidney. Mine will go to somebody else along the chain. But when it's just purely altruistic, did your colleagues say it really is okay to do this? It really is, you really will still be healthy. You won't suffer any ill consequences?
Yep, medically there was no concern.
Okay.
Kidney transplants are done enough. People donate kidneys. It's safe enough. So I didn't sense any real concern there. Sure, there's a statistical tiny risk. Anytime anybody has anesthesia, something bad could happen. But it's so unlikely that I wasn't worried about any real bad health consequences coming from it. The fact that I didn't know the person, in a way, made it nicer for me because it makes me be able just to do what I think I'm supposed to do and not have to know the outcomes or know the person or feel like I still owe them something or make them think they owe me anything.
So you had the medical exam to make sure that you were healthy and that your kidneys were healthy. You saw the psychiatrist, and he said, yeah, you're crazy, but go ahead. And
Roughly, yeah.
So then what happened next? Did you have to, with regard to time off work, did you have to plan it so you could be off for a while?
So I had 3 weeks of vacation I wasn't using that year anyway. So I waited for December, just decided to do it at the end of the year. So I used my 3 weeks of vacation. They had told me that it takes about 6 weeks to recover. And I said, yeah, that's for other people, but I'll be fine in 3 weeks. I was crazy to think that. 3 weeks into it, I was not better enough. So I ended up needing to have some friends cover some work things for me. I should have believed them and scheduled to not be working full time for 6 whole weeks. So anyway, I had the donation, had those next 3 weeks off for vacation time just to lounge, and then needed some more time after that to get my strength back to really be back to normal.
You really are a good guy.
I don't know about that.
So you donated 3 weeks of vacation to the Mayo Clinic, and you donated your kidney. So it required a general anesthetic. And how long is the surgery? And how much pain was there afterwards?
The surgery, I don't actually know. I was asleep then.
An hour.
You
hour and a
know
half, maybe?
operating rooms better than I do. I'm supposing it was an hour and a half. So there, woke up that afternoon, spent that night in the hospital, and went home the next afternoon. So it was just one night in the hospital for me, that immediate post-operative night. I think I might have had something for pain that day. I think I took ibuprofen once after I went home. But pain-wise, no. For me, it was just tiredness.
How big is your incision?
Whatever this, 4 inches.
So they do part of it through the scope, right?
Yeah, they call it laparoscopic, but they have to get the kidney out. So they work through their scopes and do it all through the tubes and the lines. And then to actually plop the kidney out, there's an incision from the belly button down that's big enough to let the kidney pop through that.
Yeah, they put it in a sack and then pull it through that hole. It goes when it comes out.
Jeez.
Would you like to hear that again?
No, please no. Why is it that all of a sudden now, 6 years later, we're hearing about this story? Who is Max, and how does this? What is the next chapter of this story?
Good question. Somehow, the initial question of why does somebody do that is really hard to answer. Related to that, I didn't want it to be about me, really. I decided I should do this, so I wanted to. But I didn't want to have to explain why, because it either makes me look odd or it makes me put pressure on somebody else saying everybody should do this.
Yeah, I'm looking at you, Shives.
Yeah. So it was about a year before I thought I even wanted anybody to know about it. So a pastor knew and some close friends knew and the family knew, but others know. And the few colleagues that had to help me out for those 3 weeks when I was getting my strength back and missed a few clinics. About a year later, I was talking to somebody and they said, there are a lot of people that need kidneys. And if you would mention what you did, maybe it would encourage people to donate. So a year afterwards, I did do a little interview thing, which was published in some Mayo publication, I think. A couple of news places around the country picked it up, and somebody in Canada. And then they put a big ethical debate on it when they wrote about this. So there was a little of that. And then a few months ago, the Mayo alumni group said, we need more kidneys. Let's talk to the 2 Mayo doctors who have given kidneys to strangers, to unrelated people. And so they talked to each of us. That turned into the alumni magazine you mentioned. If we take it farther to Max, this is on the air. We're all friends.
Yes.
I felt like that interview was like, I gave a kidney. There was nothing much to the story. And then afterwards I thought, but there is something to the story, because I do have a friend named Max, and he's getting really tired and he can't do much because he's about to need a transplant. And so then I added some comments to that interview saying, I did what I did. People can do what they do, no pressure. But I have a friend named Max, and he needs a kidney, and he's waiting for a donor. So I did put that there. I don't know if anybody, because of that, is doing anything, but I do have a friend that is going to be Max's donor, and so Max should have his kidney about a month and a half from now.
Oh, and Max is a friend of yours.
Yeah.
You mentioned ethical debate. What was that about?
The Canadian thing that came up when they were discussing it was mostly about, should you put pressure on people to do it, who should pay to do it, and what about doctors telling patients they should? So come to that power struggle of, you have to do this or somebody has to pay for it.
Wow, you're amazing. Good for
I
you.
don't know about
I love
that,
the story.
Thank you.
The heartwarming story of Dr. Philip Fisher, how he donated a kidney to a complete stranger. Thanks for joining us, Dr. Fisher.
Thank
Great
you
to have you
both.
on the program.
Thank you.